Hello, everyone. Thanks for joining us at SABCS 2025 Snippets. I'm Rahul Gosain, a community medical oncologist and one half of the Oncology Brothers. Today in this segment of Next Generation Endocrine Therapy, I'm excited to welcome Dr. Mafalda Oliveira from Barcelona, Spain. Thank you so much for joining me.
Thank you for inviting me. It's a pleasure to be here.
You know, right this minute, we have our aromatase inhibitors, or SERMs, but now we've seen a new class of drugs come our way. Oral SERDs, PROTAC estrogen degraders. What do we know? And for our patients, are they better tolerated? Are they working better?
Well, this is a very exciting area, actually, because it was a long time ago since we last saw the approvals of the last endocrine treatments. So oral SERDs are drugs that destroy the estrogen receptor, degrade it, and hold the promise of being better endocrine treatments compared to the ones we have right now. What do we know so far? So we do know that these drugs act preferentially on tumors that have a mutation, that is the ESR1 mutation, and they are better tolerated than standard aromatase inhibitors. And there is another very important fact, that is, these are oral drugs. So
Yes.
the SERDs that we do have approved right now, or we had approved until this new generation was an IM, an intramuscular SERD. And this, of course, for patients has some limitations and some side effects related to the site of administration. So these drugs actually hold the promise to also be active beyond tumors with ESR1 mutations. There are currently ongoing clinical trials testing the drugs in earlier settings, not in the metastatic late setting, but in earlier settings, to see whether this is true. If it is true, and if these drugs are better tolerated than the ones we use in that setting, the aromatase inhibitors, for instance, that would be a major breakthrough for these patients. Of course, we have to wait for the results of the clinical trials, but let's hope to see whether this is the case or not.
Absolutely. And these are exciting times because here at SABCS 2025, we are seeing that oral SERD in that adjuvant settings. So we look forward to that data.
Exactly. We will see those data and see whether what we are seeing right now is true or not. Looking forward.
Absolutely. Thank you so much for joining me today. These are exciting times for our patients, and our hope is because of these interventions, our patients are living longer and better.
Thank you so much.
This is great.
It was good.
Yeah, thank you. You know, our goal with all these conversations, let's make sure that whosoever is listening is tying in and saying, okay, let's look forward to the data.
Okay,
So,
nice.
Thank
Okay.
you.
Okay.